Hey everybody, I am really happy to have you join me today. This is Dr. Becky and I am here to talk to you about ADHD. I decided to do this video so those who weren't able to attend could still preview it. I just really think it is such an important topic. So let's get started. All right. First of all, I want to say that this presentation is specifically meant for people that are clinically licensed and able to diagnose for different types of mental health disorders. So this presentation, we're going to move from one area to the other, from the beginning of diagnosis to treatment. And we are going to provide as much information in a short period of time as we can. So hold on and let's just move forward. Before I really get into this topic, I think this is one of the most important things I can possibly say today, is that anytime we work with different diagnosis, mental health diagnosis, we oftentimes tend to look at it from a pathological standpoint. But in fact, there are so many amazing and great aspects of so many of the symptoms that are oftentimes associated with certain different mental health diagnoses. And these symptoms can actually serve as strengths, and they can really help people through their life once they can learn how to manage their symptoms, because that is very important. Sometimes they can be problematic, and sometimes they can be just a huge asset. So I just really wanted to start there. I also like to tell people that I really see a lot of the typical mental health diagnosis as being on a scale. So where are you on that scale with ADHD symptoms? I mean, the fact of the matter is we all have some. That is just a fact. We are all subject to distractibility. We're all subject to inattention at times. Many times we are very emotional reactive, right? And we can be impulsive. So those are very, very common. So we look at where is a person on a scale from 1 to 10, right? Even though you may have a lot of the symptoms, if they're very mild and they don't interfere with your functioning in life, like on a scale of 1 to 10 and 10 being the highest and 1 being the lowest, if you're somewhere at a 2 or 3, well, guess what? They're probably not interfering with your functioning. And not only that, again, I want to say how important that these characteristics and these traits and these symptoms can be once we learn how to channel them properly. And so I wrote down a list of just a few ways that they can serve an individual in a very powerful way. I have to tell you something. I'm just going to do a self-disclosure here right at the beginning. It was not until I was in my master's program and then graduated and I started working with people with ADHD symptoms, and people came to me asking if maybe they had it, and so I started researching it, doing a little more diagnosing, learning more about it. And I discovered along this way that I actually had ADHD. I had it all my life and had just lived with it, not knowing that there was anything different. I thought it was normal for everybody. And it was very interesting and very insightful for me to learn and start to recognize how through my life, in some areas, I had learned to channel my ADHD symptoms in certain ways. I had learned little techniques to help me when I started seeing that I had problems that were interfering with my ability to be successful in school. It really was going to school that really pointed out a lot of my problems that that actually truly interfered with my life. I couldn't read a book at all. I couldn't stay on a page very long. I had a hard time whenever I opened up the computer and was so distracted. And then even when I was practicing group therapy, I was told with feedback that I would talk over other people. I had a English teacher that told me that my sentences just went on and on and on forever. And then I even was doing a big project in my master's program, and I was told that I threw everything in, including the kitchen sink. So through those master's program, even though I was getting all this feedback, it wasn't until I was diagnosing that I started seeing that I actually had ADHD. So it's very interesting how sometimes this can come about. I did as I did listen to that feedback as an adult, I was able to start making some adjustments and started to use it towards my advantage instead of my detriment. So just want you to know that I now see how many ways it has served me in my life in very positive ways. And I haven't really talked about the positive ways. I only told you about some of the negative ways, but I'll give you a couple examples. I recognize that I have an ADHD brain now, and I'm always thinking about the next step and the next venture and the next thing I want to accomplish, right? My brain is always going in so many different directions, and it's just really exciting. It's led me down many, many different paths in life that have been wonderful and exciting, and I've learned so much. And my brain is always soaking up information, and I love to learn. And that I have found is very much part of some of my symptoms is that need to learn. So I think I just wanted to point out a couple of very valuable things that I have learned from having ADHD. Thank you guys so much for letting me take a little time to talk about myself there. All right, I think this is one of the hot topic areas. There are a lot of different reasons that people are fearful of diagnosing ADHD. And I shouldn't just say fearful. I think many people, especially counselors, social workers, have been taught that is out of their scope of practice. I also know there's a lot of misconceptions about overdiagnosing ADHD. There's also fears of the medication that is used to often treat ADHD. So with all of this confusion, people aren't really sure who should be diagnosing. But I will tell you that I have not ever seen any mental health professional that wasn't able to diagnose ADHD. I actually worked at a clinical setting with medical doctors, and I really thought that it would be the medical doctors that would be doing the diagnosing. However, I found that they kept sending everybody to me. I had more experience and more education on ADHD and treatment of ADHD than they had, which is what I learned from talking to them. And they were wanting a secondary opinion, even though they thought a person may or may not have diagnosis. They really wanted to get that second opinion. And so regardless, I diagnosed many people through that clinical setting and provided that information to the providers so then they could make a decision whether or not to prescribe medication for them if that was one of the things that they were considering at the time. So yes, this is something that clinically licensed people, licensed LMSWs, LPCs, also can definitely diagnose. Right. So I do know that one of the big reasons that people are hesitant to diagnose is because of the medication factor. And the medication factor comes into play in many different areas. And that could be, for example, the fact that the medication is a high, powerful stimulant. And people are very concerned about giving a very powerful stimulant to a young child, which of course they should be. The other factor is that it is often misused, for example, on college campuses. I have diagnosed people on college campuses or have people have come to me with needing assessments and have found that they really were just drug searching because it's a hot ticket item to help you stay awake at night when you're studying for finals or whatever it is that you need. And so that is definitely a concern, especially for that age group. Also, there was a point when ADHD was first diagnosed, and it was interesting because I was actually working with many children at the time, teaching lots and lots of children's classes. And all of a sudden, I had these children that just seemed to change their personality. And I found out that they were on this medication. And of course, I think it kind of developed a bad rap from that point because of the fact that many of these kids were truly over medicated. They weren't titrating the medication to really work for them because of course they should have their same personality. It shouldn't change. It should just be a little more managed. And so that became a huge concern and problem. And so I think that's why sometimes it can get a bad reputation. We definitely want to be aware of all those factors, and that's why it's really important to monitor once people start on medication, if they do, and also to emphasize doing a very thorough assessment and obviously making sure that we used evidence-based practice as we're doing so. So what are best practices in ADHD assessment? Well, let's get started with what is the most effective way to diagnose somebody. First, you have to use the DSM-5 TR criteria. Hands down, if they don't meet that criteria, they don't receive a diagnosis. But to really effectively understand if they do meet that criteria, it is really important to use some collateral information in a variety of different sources. So besides using the clinical interview, which is key, it's important to also try to gather collateral reports. And those reports can come from family, friends, daycares, teachers, church instructors, wherever that might be that individuals are exposed and are able to observe the individual that you're seeking a potential diagnosis for. There are also, of course, wonderful rating scales that can be used in any of those settings, and they can be given to many different people to be able to gather more information. And that's really important because in order to give a diagnosis, it has to demonstrate that the symptoms occur in more than one setting. So in other words, it's not just at home, it could also occur at school or in a daycare or at work. And that's because there may be something that impacts an individual, such as trauma at home. And so the symptoms just appear at home, but not in other settings, which usually mean it's more trauma related as opposed to ADHD. Another thing that's important is to recognize that we must know just the level of severity of the impairment, and also that it understanding when the onset was, because they do need to have the onset of some of the symptoms before age 12, and how much it clearly impacts their ability to function. And of course, what we do is we take these results and we integrate them into one collaborative treatment plan. So that's wonderful about the diagnosis, right? Is it really helps us to guide the treatment plan and how we're going to work with the individual. All right, so this is where we get that DSM-5 TR out, and we look at the ADHD symptoms that are necessary to diagnose an individual and recognize that the criteria requires 6 of the symptoms of inattention, and they have to have persisted for at least 6 months. Now, if they're an adult over 17, then they have to have 5 of those symptoms. So because this is how we diagnose ADHD, I wanted to make sure and write down the different symptoms right here. I'm not going to go through each of them because I know you can get your little books out, or you can read this slide and you can see what the symptoms are here that need to be present. And also, as a reminder, these are inattention symptoms specifically right here, and they have to have persisted for at least 6 months. And they also have to have occurred at least some symptoms before the age of 12. So as we know, we can diagnose attention deficit hyperactivity disorder without the hyperactivity part of it. They still get the same diagnosis, we just specify what type of ADHD they have. So in order to diagnose hyperactivity, we do need 6 or more symptoms that are listed here, and they must have persisted for at least 6 months to the degree that they're disruptive, right, and inappropriate for the person's developmental level. And that's really key because, again, many people might have the symptoms, but if they don't disrupt their environment, they don't cause problems. I always say if they don't cause problems physically, mentally, socially, at work, at school, then they're really not a problem. So we really want to look at if it does create a problem in different settings and situations. So here's the list. And again, if the individual is 17 and older, they have to have at least 5 symptoms. If they're younger, they have to have at least 6, and they have to be ongoing for at least 6 months. All right, I want to reiterate this because I already said it. There have to be several symptoms of inattention or hyperactivity before the age of 12 in order to attain this diagnosis. They also have to have it in more than one setting. So, in other words, when they're with friends or relatives or school or work or home, not just around their parents only, for example. If they have the parents reporting that these symptoms are very, very prevalent, but a school doesn't report, or a daycare doesn't report, or other family members, grandparents, or whoever spends time with the child, then it is very likely that what the parents are seeing and experiencing is a result of the environment that they're in, and there could be other things that could be creating that, sometimes trauma, for example. So important that there is clear evidence that the symptoms do interfere with their ability to have quality social or academic or occupational functioning. It is oftentimes in the school setting when I have parents or teachers that will approach me because now their kids are going to school, now they're having a hard time focusing, they're having a hard time listening, they're distracted, they're picking on Johnny sitting next to them because they're bored, they're fidgeting, and that's when they typically will come into the office. So we do see a lot of younger children that will be coming into the office with potential symptoms that are definitely recognized as being problematic. And lastly, it's really important to recognize that there are not other types of symptoms that are happening. And we'll talk about this a little bit more. And of course, things like schizophrenia or other psychosis, typically we're not going to see in younger children, but we could see them in older children or teenagers, specifically adolescents, right? Or adults, of course. And we will be working on both adults and children with our diagnoses. So part of diagnosing means identifying the subtype, whether they simply appear to have inattentive presentation, or perhaps they have a very hyperactive, impulsive presentation. And sometimes, as we know, they could have a combination of both of these. And so identifying exactly the subtype and then including that in the diagnosis is very important because, again, that will guide the treatment. There's very difference between those types of diagnosis. And so that's important to understand, along with the specifiers, because some of the symptoms may impair their functioning to a mild degree, while others may severely impair their functioning. And that again can guide treatment, whether it's in the school setting or at home. So it's important to identify the subtypes and the specifiers. So I just want you to know that as a psychologist, I performed many assessments for quite a few years for a spectrum of different mental health, cognitive developmental issues, intellectual developmental issues. And there is never one time when we simply used screening tools, tests to make a determination for a diagnosis. Everything was always backed by a comprehensive clinical interview that is so very important. The screening tools, the tests are great, they provide additional information, but that comprehensive clinical interview is very key. So when we are putting together that intake and we recognize symptoms, we want to dig a little bit deeper and ask some more specific questions. And that can actually come along anytime when you're working with an individual and you start seeing different symptoms surfacing, right? Then you can always take a moment and do a little bit more evaluation. So we want to do this very thoroughly when we're seeing certain symptoms arise in individuals. And of course, we take that developmental history because there oftentimes can be some heritability with ADHD. So we want to know if there is in the family. And of course, we want to rule out any other disorders that can really potentially mirror ADHD. And we want to look at onset, duration, and the pervasiveness of the symptoms because that will help us rule in or rule out ADHD. And then if it happens in multiple domains like school and work and home. And then of course that it really helps to get collateral information. We have to have it from at least two sources, as I said, but more is even better. Besides, of course, doing the interview, it's really important to use some kind of screening tool. As I mentioned earlier, documentation is really important. And when we have a screening tool, some type of assessment that we can use to back up our interview, it really validates the diagnosis. I have never given an ADHD diagnosis to any child without doing some kind of a screening tool. Now, I have done a clinical interview with adults, just doing the checklist without necessarily using a specific screening tool because they typically have a little bit more insight and awareness. And plus, I can also observe a lot of the behaviors. I just want you to know that the ones I have listed here are actually ones that are available either in OneNote or in the therapy notes library. There are a lot of other great tools. So we are just going to focus on these today. And the first one is the Vanderbilt one. It is a great assessment. It's wonderful. You can send it to a parent in the portal. There is a parent version available, or you can just click it, open it, and do it right there in the session and get the results. It's awesome. I really recommend looking at OneNote and pulling that up in the clinical section, clinical tools section, because it also has the teacher informant. And I would just suggest to send it to with the parent, have the teacher, give that teacher a deadline, have the teachers fill it out and have it back to you the next week so that you can get the evaluation from two different individuals in different settings. So check out the one in OneNote. The other one that is also valuable is the Amen ADD test that's available in OneNote. It can be very, very helpful for gathering information, and it is used for ages 4 and up. So youth to adults can use that same one. And of course, a 4-year-old is not going to fill out the test, but a parent can fill it out with their observations for a younger child. But if they're old enough to understand the questions and complete it, typically around 7, 8 years age, they can fill it out themselves. And then you can also have a parent fill it out, which is ideal because then you are able to get information gathered from two different sources. And that is wonderful. Also, if I have an adult that's completing one, because again, we need information from a couple different sources, I typically will ask them if they have a coworker, a family member, a parent, or a spouse, if they can have them fill it out too. It's very interesting to see that sometimes these results can be very contrasting in many ways. It also, I have found, helps to guide my treatment plans because we have discussions about how other people in their life observed other characteristics that maybe they did not observe. So it's awesome. I really loved using the screening tools, and I think both of those tools are really great. It is interesting to see the outcomes of the Amen, and that is something if you need further clarification on, please reach out to me and I can help you with interpreting the results and what you can do with them. The other one for adults specifically that is in therapy notes, also quick little tool, is the ASRS. Super quick to do, easy. It's a great screening tool for adults only. And I would recommend that if you do the ASRS and it demonstrates that there are symptoms of ADHD, then pull out OneNote and do the BAARS that's available because it is a little more advanced tool. I don't know if advanced is the right word. Thorough is the better word. It is a more thorough tool. It will give you more information. But the ASRS is great just for screening, and then to do a further assessment, use the BA or the BAARS, we call it, in OneNote. And also Dr. Amen's ADD test is also available in OneNote. So you can use either of those. I definitely recommend both of them. I wrote down here just some general other tests that I don't have available currently, but I'm sorry, the first one I do have available, and it can be used for ADHD, but it also can be used for other things. The BDEFS is specifically great for executive functioning, and so it can be used for other types of diagnosis that you're trying to gather more information on that involve anything related to executive functioning, so cognitive or intellectual diagnosis, for example. And these other ones are not available currently, but they are great tools if you were to come across them. I would highly recommend them. The Connors 4 is just an outstanding tool. I have used it, and also the Brown. So there's just some ideas for you to use. Now, I'm not going to go into each and every single one of them. Just want you to be aware that, of course, just as we always do, we have to rule out other diagnosis. Differential diagnosis is not always an easy thing to do. I love to use decision trees. We're not going to go into that right now. That could be a whole nother class in itself. But just know that there are a lot of symptoms that can look like ADHD symptoms, but there might be other underlying diagnosis, and it's important to recognize that, because once you treat the underlying diagnosis, then the symptoms of ADHD could go away. So rule out and consider, here's many of them that are listed below, but here's the other tricky part of this all. Even though we want to rule out other diagnoses, just to clarify, to help us understand, we also know that ADHD is a diagnosis of inclusion. In other words, it can co-occur with many other disorders. We especially see it right with younger kids with behavioral conduct, with kids that have sleeping disorders, because their brain just keeps going all night long, and sometimes they have a hard time sleeping very little. So we recognize that they can co-occur. So that makes it a little bit tricky, definitely. I had an individual that came to me that had a severe neurological disorder, and the parent just kept saying, I'm pretty sure that he also struggles with autism, or I'm sorry, also struggles with ADHD. He was autistic, I should say. This individual was autistic. And so because he was autistic, everybody just never paid any attention to any other potential disorders that he may have. And with a little bit of clinical interview, doing the assessments, we definitely saw that this individual also was ADHD. And once he received that diagnosis of ADHD, we were able to create a better treatment plan that was very, very helpful for the individual. So just something to consider when you're looking at ruling in, ruling out. Also look at comorbid diagnosis, because there are times they may have more than one particular diagnosis. All right, now if you really felt that you wanted more information, there are psychologists specifically that do further in-depth assessments. I've met many psychologists, frankly, that use the exact assessments that we just talked about. So the other assessments aren't necessary to diagnose, but for different reasons, especially to rule out potential other diagnosis, somebody may want to meet with a psychologist. In this area, I definitely would recommend the Northwest Neurobehavioral Health. I think that they do the greatest job at really doing a very extensive assessment, and they have several different providers, and they work with a team and collaborate on assessments. So I definitely recommend going to them and providing a referral to them if a further information is needed and clarity is needed. As with any diagnosis, there's lots of ethical and clinical considerations, and that's why it's very important to document and to provide justification for the diagnosis, or rationale, as we call it. Make sure that your rationale is very clear and that it meets the criteria that is in the DSM. Also, using those standard tools and collateral data screening tools, different tools from different individuals, will definitely support that diagnosis. And so make sure that you have that available in the treatment plan. You can mention it. You can also have it as an attachment in therapy notes in their file. And of course, most of the time when we work with somebody who we diagnose with ADHD, the question of medication will come up. And this is always tricky because we want to be careful. We are not medical providers, so we do not recommend any particular type of medication. However, we can say that you can go talk to a medical provider about it, and we can provide some basic information if needed. We definitely want to make sure that we provide information that can help prevent misuse of it. For example, I might say something like, hey, once you start the medication, right? Observe how the individual's doing, or yourself, as the case may be, and make sure that you talk with the doctor about if you're seeing improvement, or if you see things that are worsening, or you just really don't see any changes at all. That's very important. And also, of course, we want to evaluate, especially when people are getting older. I have people that have come into me at 20 and said they were diagnosed with ADHD when they were 10. And at that time, it seems to just stay right on their chart. But however, talking to them, you can see that they don't have those symptoms any longer, or if they have, they've learned how to manage it. So it really is not a problem. And that diagnosis can absolutely go away, even if they had it earlier. I'm all about evidence-based practice, and evidence-based practice research demonstrates that the combined treatment of both ADHD medication and therapy is hands down the most effective way to really help people with ADHD. Now, with that said, I absolutely do not approach medication typically at the very beginning. I might mention it to a parent, but I do look for their feedback, because there are lots of barriers for parents to medicate their children, and I completely understand why. And I do like to help work with them through some of those barriers if needed. But if I can see that they're resistant to that at the very beginning, I simply say, okay, let's try some of these different treatment approaches and let's see how they work. And then we move forward from there. I will tell you that I had a couple of parents just this last summer who did not want medication. And so we opted for some different treatment approaches and really had some great success with both of these children. One especially, it was very clear that once we integrated, I should say, some of these different treatment modalities, we were able to not even think about using medication. And so that is just really powerful to know. Really, it's also a combined effort that involves a lot of coordination between individuals. If you're using this prescriber, of course, but also counselors, schools, the family, all make a huge impact, because many times we use behavior modification programs to help people. And if the child is going to school, it really helps to have, for example, an IEP program in place, or to be able to have at least the teacher, the school counselors being able to monitor with the child, being able to provide accommodations if needed, which is usually requires an IEP program. So that's why we really want to coordinate between different providers, and helping educate everybody involved is very, very important. Even those who may be very familiar with ADHD, I find that most individuals are not really good about coming up with very, I would say, catered treatment plans for the individual. A lot of times people look at it in a very generic way, and I really like to look at each individual and the symptoms that they are expressing or I'm observing, and look at ways that we could specifically intervene with those symptoms. And so that's why it's really important to educate parents, teachers, and different people that are involved in that process. And a key component that we oftentimes overlook, I think, is the nutritional and physical aspect. Exercise and the right nutrition is really important to helping children, and of course adults. All of these things apply to adults, absolutely. Typically adults have more insight, but not always. As I mentioned myself, I have very little insight and understanding that I even had the symptoms. And so the more we can educate people, the more impactful it has, and the better we can come up with very specific treatment plans to help with it. As you saw, the combination of treatment and med management has the potential for the best prognosis and outcomes with individuals with ADHD, whether it's children or adults. So, as hard as this is, there is a point where we really do want to talk about meds. That's a little tricky, because as therapists, we're like, that is not in my ballpark. That's not something that I do. That's not my focus. But I've learned that it's really important to provide psychosocial education to our clients. And frankly, a lot of the doctors do not do that. So the education that we have to provide is very important. As therapists, of course, we do not prescribe, but we can definitely educate and support and collaborate with the providers if that's what they choose to do, if they choose to go with medication. So our role, of course, is to encourage clients to explore all treatment options, including non-medication and medication paths. Depending on the situation, if parents are just very shut down right at first, they're not interested in medication, I am definitely not going to push it. We're going to talk about other treatment options. And then as we continue to work together and we continue to see the same problem surfacing and not a lot of improvement, I will broach the subject of potentially having medication. But we also broach the subject of whether we have medication that is a stimulant medication or non-stimulant medication. So that is part of the psychosocial education that we provide. The other thing is there's a lot of unknowns or stigmas around the medication, and I think it's important to help educate our individuals. But always we talk to them about talking to a provider about the medication so that they can speak to an expert on medication. I do also know that it's important to really normalize it. It's very typical to seek a medical consult. So it doesn't mean that you have to get on the medication, but if you simply consult with a doctor, then you can gain more information. And of course, a big part of providing education to our clients is saying, hey, when you get on that medication, you're going to want to really track the effectiveness of that medication, see how it is affecting the behaviors, see if it has an impact on your emotions, et cetera, right? So tracking the effectiveness is very important because then we can easily adjust the medication, stop the medication if needed with, of course, working with the provider to do that. And that's why we want to always try to collaborate with the providers if they're available to be able to provide the best outcomes. Okay, so we definitely have talked a little about the do's, what we can do. So, but I wanted to make this little chart for you to focus on what we don't do, because that is just equally and crucially important to know that we do not recommend a specific medication or dosage. Even if we've heard that it's been really great, we can say that, hey, so and so has talked about this being very positive for their child. Talk to the doctor about it. We don't recommend it. We don't recommend the dosage. We also don't adjust ever or tell them to discontinue the medication. If we're seeing some potential side effects that are alarming, we simply say, hey, talk to your provider immediately about it. Or anytime you have some very alarming side effects and your provider's not available, you can go into the emergency department for sure. And we never ever want to replace medical advice. That is not within our scope of practice to do that. And we definitely want to be able to coordinate with prescribers if needed and talk to them about the advice. And there may be some adjusting if needed as we have those conversations with them. And of course, with parents or an individual, an adult, I have often seen a stigma and a fear about using medication. And I think especially since we live in this world of opioid addictions, and there's a lot of concerns with drug and drug misuse, there's a lot of fears surrounding medication. And so we do have an opportunity to validate their fears and own their fears, but also to educate them about that because a lot of the fears are based on misconceptions and misunderstandings. So this next slide, I'm going to talk a little bit more about some things that we may be able to say that can be helpful. Well, first of all, we can let them know what a stimulant is. I mean, they can Google that very quickly. And there are lots of different types of stimulants, and I wrote down just 3 of them that are very commonly used. And what the stimulants actually do is they increase dopamine and norepinephrine activity in the brain to improve attention and impulse control. And those are 2 different neurotransmitters that already are in the brain. They're already there, so it's not like we're adding a foreign substance in the brain, but the stimulant actually increases that, which then helps them to improve and to calm down their brain. a lot of people don't recognize that's how the stimulants work. And of course, a big thing is to recognize that it's like they put brakes in the brain, which improves their focus and their emotional regulation and task following through. And if a person truly doesn't have ADHD, it won't have the same effect on them. And that's key. That's why it's very important to monitor, as I mentioned that here last in the slide, to monitor how they're doing. See, monitor its effectiveness. Is it helping? Is it making things worse? Is it better? Is it helping mildly but not really making a huge impact, right? That's when you can talk to the providers and they can make changes if needed. And if it's absolutely not working, that's a good indicator that that person probably doesn't have any ADHD problem. It's a good indicator that maybe there might be some other underlying issues like trauma, maybe a toxic environment that's creating a lot of these issues that they're seeing. So we really want to look at that and help them understand and educate them, because that will help with a lot of the stigma and the concerns and the fear. And they're very legitimate, because I definitely have seen that in the past. Another thing I really like to do, frankly, is I like to just give some examples of people that have used medication, stimulant medication, and also for those who haven't, and recognize that I've seen really great outcomes with both. And sometimes with the stimulant medication, it hasn't worked on people, and then the providers recommend that they stop taking the medication. And other individuals, it worked on so incredibly well that they were able to actually start to function better at school. They were starting to get better grades. They developed better relationships and friendships, because frankly, they were so impulsive and hyperactivity before that they couldn't even keep friendships. I've seen it help with families, with adults, and how they were able to manage their families. And as I'm telling you these stories, I should say, as I'm telling you this, I'm thinking of these stories of so many different people that I've worked with, that it had such a significant impact when they started taking the medication. And then there are some that it really wasn't working, and so they completely stopped the medication, of course, with talking to the provider. So I know that there's a place for medication that is very valuable. And I also know that that medication alone is simply not enough. It's really important to get those behavior interventions, that mental health treatment, or whatever it is that they need. And therefore, we want to be able to have the most successful prognosis and outcome. I like to give one example, one particular client who the parent brought the child in at 5 years of age, and this child was all over, up and down and around this chair, like for the whole entire time the parent and I were talking. He never stopped moving, and he was under the chair, around it, behind it, 100 times during this session. Very, very strong case of ADHD and hyperactivity just from observing that one session. But the mother was very concerned about the behavior. It was fearful that this behavior was going to result in like antisocial or conduct disorder, because it wasn't just what I was observing. The child didn't have friends at school because he would lash out, he would be impulsive, he would hit, he would be mean. He'd make threats, and this is a 5-year-old, and he'd threat to beat somebody's head in, or he was violent in his room and would just destroy things. And the parent was so worried that there might be something that was really a personality issue, and this person was not a good person to the core, this little child, right? And really all it took me was one conversation with the child, and I knew that this was a child that was just really a great child. He just had a real problem. And I think in this particular case, there probably had been some exposure in the womb to alcohol or drugs. This mother was actually an adopted parent. So the fact of the matter is, we started this child on some medication. And the reason I'm going to back up for a second. The reason I knew that this child wasn't a conduct disorder or antisocial personality potential, because of, even though there were a lot of horrible behaviors, is because he showed a lot of caring and empathy and had even some insight, and was able to say that, the reason that he did the things that he did is because his brain just drove him crazy and it wouldn't shut down. And he was really a caring, sensitive child. So once we started him on medication and he was able to start performing well, slowly over the next course of a few years, the mom started integrating him back into a school setting, and he was able to be successful. And at high school, he quit taking meds altogether. He didn't tell his mom in this case. I was able to interact with him just periodically when things were happening as he got a little bit older, and he would come into the office for a couple sessions. And he's like, I stopped taking my medication, and he had been doing really, really well on it for a couple years. And this young man that developed actually is really quite a success story, because he recognized in high school when he quit taking the medication that he was so grateful that his parents had put him on the medication, that it really had helped him to calm down his brain and helped him to be successful in school and to be able to have the relationships and get the grades that he needed to go on to be successful as he enrolled in the military. And the last time I talked to him, he had actually enrolled a second time. So you just think about a child that goes from being those severe behavioral problems and to a person that has to be extremely well disciplined in the military. It just is a great example of how valuable medication really can play an important part. And I'm going to say stimulant medication in this case can play a very important part in people's lives. I'm going to go on to the next slide now. So here are some things that you can say just to help educate the parents and also to make sure that we're staying within our scope of practice. Stimulants can help the brain's attention center work more efficiently. It's like finally having power steering for your focus. And I think understanding these concepts can really be helpful for individuals who want to take it for themselves. For adults, I talk a lot about children, but adults no different. And the fact of the matter, this next one is so true. Medication is definitely not a replacement. The efforts that it takes to change and to be able to focus and to direct and to complete things or whatever the case may be takes a lot of behavioral efforts. Medication isn't simply going to change our behaviors, so we really have to learn how to change our behaviors. But the medication can help to calm the brain, to provide that chemical balance that will allow us to make the changes that we need to make. And then once we are very successful at implementing those changes and we have good coping strategies, then it is very possible, as that young man I talked about, that he doesn't need to have any medication because he can now know how to manage his symptoms without medication. And also, we definitely recognize that there are individuals that may not present with ADHD symptoms as they get older, because our brain is always changing. And so that's why it's good to do ongoing evaluations of individuals as they age for that very reason. Another thing that you can say is, of course, recognizing the side effects or the emotional shifts if it's not working, if you find yourself just getting more frustrated, more angry, or even very, very depressed, something happening like that, or not being able to sleep, that's when, of course, it's really important to go in and talk to the doctor about the dose or changing medications or whatever the case may need to happen at the time. And so those are just a few ideas of things that can be said and done. Just don't think I can say this enough times that ADHD symptoms are highly individual. And it's so true that many of them are not disruptive or harmful. So we really want to hone in and focus on the symptoms that create impairment in our daily life. And we know that, especially when we're working with children, that it's good to collaborate with providers, clients, teachers, and of course the family. And that those interventions that we use may be everything from psychological to environmental to behavioral and medical strategies, as I mentioned. I'll give you a couple examples of things that I learned to do even without knowing that I had ADHD. I learned to sit more at the front of the classroom so that I wouldn't be distracted by everything that was going on in the classroom. I learned to, when I'm studying, instead of just trying to read from the point A to point B straight through because I had a really hard time focusing, I would learn to pick questions and study topics and then look and skim through my book and look for the answers, I found that by doing that, I actually read a huge portion of the book anyway. And then when I would find the answers, it helped me to retain that information. And that just seemed to be what my ADHD brain needed, because it had a hard time just focusing. I could read the same paragraph a million times, right? I know you've all been there and not remember what you read. But when I was actively looking for something, it was much easier to retain that information and then have read pretty much the whole entire book when I had multiple questions that I needed to answer, and I had to read the chapter sometimes more than one time to find those answers. That was really helpful. I also just learned how to reward myself when I would get on like the computer. I would do a couple things. I would make myself finish a task before starting another task, and I would reward myself with whatever I chose to do at that moment. Sometimes it might be a break, watch something else. Sometimes it would be tangible drink, something I like to drink, my favorite soda, who knows. But I would find little rewards and make sure that I would try to finish the task before I moved on to another task. Also, it's okay to take a break from a task. Um, we want to just not be trying to do 10 different tasks at one time, right? So sometimes our brain does need a break, and that's found to be helpful for all people, is to walk away for 5-10 minutes from a task that you're working on and then come back to it. But that's always the kick, right? Come back to it. That's important. So those are just some specialized interventions that I found that I applied. And then when certain things were pointed out to me, like for example, talking over people, I started to be more aware of that, and then I was able to adjust that. Or when I was told that when professors told me how to run on sentences, which I still do, but in writing, I'm much better at making sure that my sentences are very specific and that I'm not also bringing in a whole bunch of different things into one paragraph. And I have tried to do that in writing and then also in conversing. I still struggle with those things. I find myself doing them on occasion, but for the most part, I'm able to be effective at them. So I just wanted to share that with you because that's a perfect example of how every single individual is different. And if we can look at specifically what they're struggling with, we can identify a very individualized intervention that can help them. There are some amazing books and things that you can read and find all kinds of interventions, and they can help if you identify specific objectives that need to work on. I love some of these books that we do have available, and I just want you to know I pulled these ones in particular out of the Nampa office, but this one is available in all the offices. I don't know if you can see this or not. Um, it was looking a little blurry from there, so I'm not really sure if you can see it. But this one is the Child Psychotherapy Treatment Planner. There's also an adult one. There should be a child and adult one in each office. And if you open it up, you can see, and these are available to check out, or you can simply make copies. We've also tried to put most of the information on these pages in OneNote. But this one, for example, gives you the behavior definitions. It gives you the short-term objectives. Oh, let me back up. It gives you the long-term goals, the short-term objectives, and then many therapeutic interventions. So if you find some objectives that you've discovered need to really be integrated into treatment to be able to help that individual, then you can scroll down and look at some of these great intervention ideas and find one that you find would be very helpful for your particular client that you're working with. And again, we have these adults and children treatment planners. They're planners. And if you haven't seen these or looked at them, they're amazing because they have just about every single disorder diagnosis that's out there in here. And if you're struggling with interventions, this is just a really amazing book. I know they're available in the office, but I tell people you might want to grab one for yourself. It's just so awesome in helping with treatment planning. So that's just one of my favorite books. And of course, we provide psychosocial education, right, to parents. So I love to recommend this book to a parent. This one is called ADHD, What Every Parent Needs to Know, and it's by Michael Reif, and this one happens to be the second edition because they've had it for a while. But what I like about this one in particular, it is actually expert guidance from the American Academy of Pediatrics, and it's packed full a lot of great information. And of course, if you want to read it yourself and learn a lot more that you can then help relay to parents, that is a great thing too. So here is the book. This is what it looks like. And if you have the opportunity to check that out, I think we may only have one of those. So again, individualized plan, looking at the problematic symptoms that are creating impairment in their life, and then recognizing that there's a lot of things that people do that are just very normal. Like we all have some restlessness, we all have distractibility at times, we all occasionally daydream, especially during non-essential tasks. And so those things aren't going to necessarily be a problem. So we don't want to focus on those. Let's focus on prioritizing functional goals and getting rid of symptoms. And this is symptoms that are problematic. And this is important to recognize that we don't tackle all the symptoms at one time. I've seen that, and I think at the beginning of counseling, I used to do that when I first started into the field. I used to look at all these symptoms and let's tackle them all at one time. But I've just found it's best to focus on one or two, especially behavioral type symptoms. And you can do some overall things, but if you're looking at changing a particular behavior, it's best to focus on just one behavior or two at the most at a time. And I'll talk about some overall environmental changes that can have a huge impact too. So we know that those ADHD symptoms exist on a spectrum from mild to severe, and that there are many traits that can actually strengthen them in the right context. And we want to then only focus on the target areas that interfere with school and relationships or work or safety, as the case may be, and emotional well-being. So I've made a list, I've made a little chart right here with some potential problem areas, and then a chart that on the right hand side that shows targeted treatment approaches. And these are just some ideas depending on what the problem is and areas that you can hone in to work with the individual. And again, it's going to be specific to that person. But let's just talk about a couple of them. They're all here for you to review, to check out, just to give you some ideas. But for example, somebody who has sleep or health habit issues. I'm going to talk about sleep because that's a big one I found with ADHD especially. So sleep hygiene routines are really important, like when we're going to sleep, what routines we're using, the food that we're eating before we go to bed, the drinks that we're having. Those things really can really disrupt sleep, or they can really help facilitate sleep. And other things like sleep hygiene include things like the stimuli, and that can be light stimuli if there's too much light in the room. It could be noise stimuli, TVs, phones, those type of things can really interfere with sleeping. People who are staying up late gaming and then sleeping in or feeling tired all day, that's going to create a problem, right? So we want to make sure that the room is a place of peace and rest. There really should be no stimuli in the room. If it is helpful for some people to have a routine such as reading, listening to some music before they go to bed, it should be calming music. And typically most books will work just fine, but definitely calming music is important. Also then, there are medications that are available to help people sleep. They're not stimulant, especially for children. I'm going to talk about that later. And that can really make a big difference for people. Melatonin, right, is super common to help people sleep, and that can really be beneficial. Also, exercise and nutrition during the day can help people at night. So if you are working all of those, working physically, I should say, if you're working physically, getting some of that energy ran out, as we would talk about it, really what you're doing in your brain is in your body is you're decreasing the stress hormone cortisol in your body, which then helps you to feel more calm. And also while you're doing that, you're increasing the dopamine, which helps you to relax more. So that's why exercise, I can't say enough about exercise and how important it is, daily exercise, but not right before you're trying to go to bed, but definitely daily exercise. Nutrition is important too, especially with ADHD. Those things like sugar content or things that are high in other, like even food colorings can be disruptive to some people. I want to say that typically things with caffeine have the opposite effects, right? Because caffeine is a stimulant. And so usually things like caffeine are not going to have a negative effect, but you don't want to take it if you're on some type of a stimulant medication. So just be mindful of that. And then, of course, mindful practices are always great. Now, we don't do all these things at one time, right? Pick one thing, start with it, and then add something else because it's a lot to try to change your whole entire life all at one time. So I like to implement strategies slowly and then come back and talk about it, see how effective they were. Sometimes it does help to implement more than one at a time because they can definitely enhance the other strategy. So we just want to be careful about not offering or suggesting too much, whether it's for a parent, a child, or an adult. I'm just going to give you one other example where it talks about inattention or poor focus, or actually, let's use emotional reactivity as an area. Um, there's a lot of different reasons that children or adults may be emotionally reactive. But even sometimes with ADHD, kids will tend to hyperfocus on things that they really like to do, right? And that is important to recognize. If they're hyperfocused on something, it is really hard for them to switch their brain. Task switching is a big challenge. And giving warning of, we're going to be finishing this in 5 minutes and we're going to shift to something else. So helping them learn how to switch and shift is really actually a very key component to working with a lot of the ADHD kids I've worked with anyhow. And then what happens overall is they reduce their emotional reactivity because they're more prepared for it. If you're in the middle of doing something that you love and you're told that you have to stop now and walk away, that's a really hard thing to do. But if you're said, hey, you've got 5 more minutes to finish this, and 5 more minutes, we're going to stop. So have fun, but you will be moving on in 5 minutes. Then you're starting to prepare yourself that you're going to have to finish this task. And it's not easy. It's still tough. It's still a challenge. I mean, parents have to be persistent and consistent in implementing some of these types of strategies, but they can be very powerful. And I've worked with this from as young as 3 years of age who had emotional reactivity, is just giving them a warning, helping them know that then we're going to switch our task. And of course, even choices at that age can be helpful. Okay, you have 5 minutes. Do you want to read a book or do you want to play? We're going to, in 5 minutes, we're going to do something like take a bath or brush your teeth, right? Sometimes you can give choices, sometimes you can't. It just depends on the situation. But that can be helpful for kids to have power over what's happening, and also they're taking ownership of it because they've made a decision about what they want to do next. And so it's just super powerful and a really simple thing to do. Even it's simple, but it does take consistency, and it's still difficult for children or adults to switch any kind of a task. So just be aware of that. I found that to be just a great intervention for lots of different types of disorders, frankly, behavioral disorders. Right. So I had a couple of children this last summer, and they both said that they did not want to take stimulant medication, at least not to start with. They were really wanting to find some strategies to help them. And in this case, both of these parents were very proactive, very, very involved in their children's life, and were really great about implementing strategies that we talked about. So I felt really good about taking this approach with them. So as soon as they said that, I respected it, and then I helped by creating a plan. And this actually has been a plan that I have now used a few different times. So I wanted to share this plan with you because I think this could be used in different components for different people that you're working with, that will focus on alternative strategies besides medication for children. And of course, adults can use the same plan with some minor tweaks and changes. Right, when we start this little venture, I do like to educate parents that there are other medications that are not stimulant medications that can really help with certain symptoms that we're seeing. And so I provided this little chart, and I just suggest that they talk to their doctor about these. But I also like to give them a little information about the pros and cons and potential side effects because it opens a door for them to know what to talk to their doctor about, to what to ask them. And I think that's extremely valuable. A lot of times people are very fearful of side effects, but when they learn that the side effect is listed because one of 10,000 people had that one side effect during the clinical trials, then it really calms their fears down a lot. So the other reason I like to provide them some information is because one thing we really want them to do is do an ongoing monitoring so that they can look and see, hey, is this working? Is it not working? Are we seeing improvements in impulsivity or in attention? And certain medications are better for those than others. And so it's just really helpful if they can monitor and also if they're sleeping better, whatever the case may be. I recognize I don't think I put melatonin on here, and that's because melatonin is really not a medication. It's just that natural occurring hormone. You'll probably find lots of kids that come into your office that are on melatonin because it's so commonly prescribed by doctors and available. And it really does help many children being able to sleep. And again, it's just a natural occurring hormone, so people feel much safer with it. And it works with our circadian rhythms. And so it can help create those better sleep cycles, which can be very beneficial. And that's really what it's to do. But I found that a lot of them use it to help them to go to sleep at night, and it has been very effective on that also. So that's just a common one that people will use. So these non-stimulant medications that I've listed down here, they are all FDA approved for children, and they work very differently than stimulants do. And sometimes they work specifically for things like sleeping or hyperactivity. And so I just like to let them know that there are other options that are available to them that they probably, most of the parents I've talked to did not know that there were other options available. So these individuals that I worked with this summer in particular really wanted to focus on exercise and diet. We also did behavioral interventions, but they were really great about following these guidelines for a really health balanced diet that actually supports focus, mood regulation, and behavior. They changed their whole family's dietary habits, and they started using more of these protein-rich foods in their diets, looking at complex hydrates. They did things like limiting artificial colors and processed foods. It was pretty interesting to see the combination of just the exercise and the diet nutrition and how effective that they were. That is why one of these parents was part of the reason why one of these parents was able to absolutely have such dramatic improvement that they did not even think and consider stimulant medications anymore at that. And the other one had enough improvement that it was no longer impacting some of the functions like school functioning, for example, friend functioning. And so they went ahead and just continued to work on the nutrition, the exercise, and some of the behavior strategies that we're going to talk about. For those parents who really wanted to focus on nutrition and exercise as the primary intervention, I like to mention, again, we're trying to educate them. We're not telling them what to do. It's not within our scope of practice. So I like to let them know that sometimes children can have some different deficiencies, some vitamin or mineral deficiencies. And so it's important to go and have them checked out with their provider, with their pediatric doctor, and recognize that sometimes that those deficiencies can be overcome with certain supplements. And there are some common supplements like fatty acids, omega-3s, or zinc or iron or magnesium that we have seen have a huge impact on children with these symptoms. And so simply saying that to them, but not telling them that they should take it, not telling them that that's going to help them, is definitely just a manner of educating them, helping them know where to go to the source to get evaluated to see if those would be beneficial. And then, of course, monitoring after if they do start on any of those types of supplements. I think this is really where our job comes into play is that behavioral and lifestyle interventions. Again, with adults as much as with youth, I have found that this is where we tend to focus the most, right? We provide the education on those other areas, but what we do in counseling is we focus on those behavioral interventions, working with the parents, working with the adults on things that can be helpful. Like positive reinforcement is huge and it's massive, and to being able to change certain behaviors and rewarding those behaviors that we want to see, and helping, therefore, hopefully, right, hopefully having those behaviors increase and not decrease. And of course, parents are sometimes at a loss on what to do and how it works. And sometimes they try some things and they're just not quite effective because of maybe little methods that they use. So, like behavioral positive reinforcement, I've seen too many parents who did something positive to reinforce the behavior, but as soon as they saw negative behavior, they would take that positive thing away. If they gave a reward or even a compliment, they would take it away, and that has the opposite impact. And so that's, again, that education piece, and working with the parents on knowing what to do, working with the parents on continuing supporting the parents when they're working, trying to help their child have more physical activity or better sleep or routines. Parents need that support as much as anybody. And the adults that we're working with do too, because they've been doing those same habits for a very long time, and changing those habits is not easy. So this does truly become the main area of focus when we're working in counseling with all ages. Here are some basic general tips that I, again, can give to both children and parents, depends on which tip it is. But for example, I have had some people come in and are just interested in medication. They heard that medication works, they want to put their child on it, or they want to go on it themselves. I'm quick to educate parents at this point about how it is important to change behaviors and lifestyle and have good strategies to implement, because medication alone is not going to change your behavior. And as soon as I tell them that, it makes sense. Medication doesn't work on changing a person's behavior, especially those adults who have been doing the same behavior and have the same habits for years. They're going to need to have some effective strategies that are going to help them to change the behaviors that are creating problems in whatever environment it might be in. So that's really important to also educate individuals who are just looking for medication to know. So important. The other thing is, if somebody chooses a non-stimulant medication, I just like to make sure that they're aware that even though stimulants work immediately, non-stimulants do not. And it can really take weeks to show effect, and so they have to be patient. The other thing, of course, as we've talked about, is just observing and tracking the response to any of these interventions that we use. That's for adults or children, and collaborating very closely with any other providers. And then, of course, I like to kind of throw this in, especially with those ones that are working with nutrition, is not to have really severe major dietary restrictions, and definitely to listen to the recommendations by healthcare, because there are times that they will just make those choices on their own. And it's important for them to understand that there can be negative outcomes by making very restrictive dietary guidelines. All right, I'm really big on this. So the last thing I'd like to say is ADHD doesn't mean broken attention. It means attention that needs the right environment to shine. I truly believe that with my work that I've seen, and it makes a huge difference when we can give children and adults the right environment to shine, the right tools, how to manage. It's incredible. So I truly believe that when we stop trying to make ADHD individuals fit into some type of neurotypical mold and recognize that their unique wiring can truly become an advantage, we're really not treating them about changing who they are. We're simply supporting them and helping them to thrive, as I gave you an example with just one of my clients, and I do have a lot of other examples. So I just want to say thank you for joining me today. I just know how valuable and how impactful this can be on really helping people in their life. And if you have any questions, you know how to get a hold of me. So don't hesitate to reach out. And what lastly that I'd like you to do, I need you to do, is write down in the comments 2 different things that you have learned and that you plan on implementing in your treatment. That would be wonderful. I'd love to hear from you on that. And we will see you again another time. Bye-bye.